There is a simple test that neurologists use in emergency rooms every single day. It does not require any machines, no needles, and it costs nothing. Yet this test can reveal silent danger inside your brain that you may not feel at all in your daily life. Welcome back to Dr. Heartwise. Today we will do something different together. We are not just going to talk about theory. In the next few minutes, you and I are going to perform a practical test right at home. If you are over 60, or if you live with high blood pressure, diabetes, or irregular heartbeat, this video may be the most important one you watch this year. This test is called the pronator drift test. It is designed to detect very subtle weakness in the motor pathways of your brain. Sometimes, before a large stroke happens, or when the brain is under stress from tiny blocked blood vessels, your body sends warning signs. These signs are so small that you cannot notice them when you do normal daily activities. You still hold objects, drive, and eat as usual. But when we remove your vision and ask your brain to keep your arms steady against gravity, the truth can appear. In this video, I will guide you step by step so you can do this test safely. Then I will explain exactly what your result means for your brain and heart health. Most importantly, I will help you understand the difference between a dangerous neurological sign and the usual aches and weakness of aging. Find a comfortable chair and a quiet place because we are going to start now. Before we perform the test, I want you to understand why it works. How can simply holding up your arms predict a stroke? The answer lies deep inside the cortex of your brain. To keep your arms raised, with your palms facing up toward the ceiling, your brain must send a constant flow of electrical signals to two opposite muscle groups. The first group are the supinator muscles, which keep your palms turned upwards. The second group are the pronator muscles, which tend to turn your palms down toward the floor. In a healthy person, the signal from the brain is strong and balanced. The supinator muscles win the tug of war, and your palms remain level and facing up. However, these nerve pathways that control the supinator muscles are very sensitive. They are often the first to suffer when the brain has even a mild problem with its blood supply. When a small area of brain tissue is damaged, for example by a tiny blood clot that travels from the heart to the brain, the signal to the supinator muscles becomes weak. The pronator muscles then take over. As a result, without you noticing, your affected arm slowly starts to turn inward and drift downward. This is called drift. The scary part is that you usually do not feel your arm dropping. Because your eyes are closed, your brain believes the arm is still in the right position. That is why this test is more sensitive than your own subjective feeling. Now let us talk about safety. I want you to do this test while sitting, not standing. If you are standing now, please find a sturdy chair and sit down. Plant both feet flat on the floor. The reason is simple. If you truly have a balance problem or a neurological issue, closing your eyes while standing can make you unsteady and you might fall. We want to check your health, not create an accident. So please sit down, relax your shoulders, and take a deep breath. We are going to perform the test for a full 30 seconds. I will walk you through each step as if I am right there with you. Step 1. Raise both arms straight out in front of you, at shoulder level. Your elbows should be as straight as you can make them without pain. Step 2. Turn your palms so they are facing up toward the ceiling. Imagine that you are holding a large invisible tray. You must not let this tray fall. Keep your fingers straight and together, not curled. Step 3. This is the most important part. Close your eyes and keep them closed for the entire 30 seconds. If you open your eyes, your brain will use your vision to correct any mistakes in your arm position and the test will no longer be accurate. So now, close your eyes. Keep your arms stretched out, palms up, and fingers straight. I will count the time for you. 30 seconds may sound short, but when you have to hold your arms out without looking, it can feel surprisingly long. Focus on your breathing. Take a deep breath in through your nose. Slowly breathe out through your mouth. Do not tense your shoulders or your neck. Just focus on keeping that invisible tray balanced. Pay attention to any sensations in your body. Does one arm feel heavier than the other? Does one hand feel like it wants to turn inward or downward? Do your fingers want to curl? Do not adjust your position. Simply notice. We are already halfway. Keep going. Do not peek, Right now, your brain is working hard to send constant signals through your spinal cord and into the muscles of your arms. If your blood vessels in the brain are open and healthy, and if your neurons are strong, both arms should stay steady. 10 seconds left now. Hold. 5 seconds. 4, 3, 2, 1. Now open your eyes right away and look at your hands. Do not move them yet. Just look at where they are and how they are positioned. Now we will interpret your results. There are 3 main possibilities, and each one tells a different story. The first result is the one I hope you see. Both arms are still at nearly the same height. They may have dropped slightly from the starting position because of fatigue and gravity, but they dropped evenly. Most importantly, both palms are still facing up toward the ceiling. This is a normal result. Congratulations. This suggests that the motor pathways in your brain, especially the corticospinal tracts, are functioning well and sending balanced signals to both sides of your body. The second result is common and often causes worry, but it is usually not a stroke sign. In this case, one arm is clearly lower than the other, but the palm of that arm is still facing upward. The arm has fallen, but it has not rotated so that the palm faces down. This usually does not point to a brain problem. It more often suggests an issue with the muscles, joints, or nerves outside the brain. For example, shoulder arthritis, a rotator cuff injury, or pressure on a nerve in the neck. It can also happen if you simply use one arm more than the other and that side is weaker. This is not an emergency, but if the weakness is significant or painful, you should still discuss it with your doctor or a musculoskeletal specialist. The third result is the red flag that this test is designed to uncover. In this situation, when you opened your eyes, you saw that one arm was not only lower but also rotated inward, so that the palm was facing the floor or toward your body. The fingers on that hand may have curled slightly. This is a positive pronator drift. Why is this dangerous? As we discussed earlier, when the brain is injured, the supinator muscles lose their strength first and the pronator muscles win. This causes the palm to turn down. This pattern is typical of damage to the central nervous system, specifically the corticospinal tract on the opposite side of the brain. That means if your left arm shows pronator drift, there may be a problem in the right hemisphere of your brain, and vice versa. If you see this kind of drift, the next question is critical. Is this new, or has it been there for a long time? If you have had a stroke in the past, or a serious head injury, this may be an old defect. It might be a permanent scar in your nervous system, not a new emergency. In that case, you and your doctor probably already know about it. It still reminds you, however, that your brain is more vulnerable and needs extra protection. But if this is the first time you have noticed this, if yesterday your arms were normal and today one arm drifts and rotates down, or if this drift appears together with dizziness, trouble speaking, facial drooping, numbness, or a sudden severe headache, then this is a medical emergency. Do not wait. Do not go to bed hoping it will disappear in the morning. Brain cells die quickly when they lose blood supply. The earlier you reach the hospital, the more brain tissue can be saved. You must seek emergency care immediately. Many older adults confuse the natural weakness of aging with neurological weakness. Aging weakness usually affects both sides slowly and gradually. Neurological weakness from a vascular event often comes suddenly and affects one side much more than the other. This test helps you see that difference. In addition to the arm drift test, there are a couple of other quick checks you can do after this video. Together, they form a small at-home screening toolkit. The second quick test is for fine motor control. Try touching the tip of each finger to the tip of your thumb on the same hand, one by one, as fast as you can. Then repeat with the other hand. If one hand is much slower, less accurate, or struggles to complete the sequence, that may suggest a problem in the brain or the cerebellum. The third test is for sensation. Ask a family member to gently touch both sides of your face, both arms, and both legs using something soft, like a piece of cotton. Close your eyes and tell them every time you feel the touch. If one side feels clearly duller, weaker, or numb compared to the other, as if you are wearing a glove or sock on just one side, that is another sign you should see a doctor. Now let us connect this back to your heart. Why is a heart health channel talking so much about the brain? Because the heart and the brain are partners. They can protect each other, and they can also harm each other. One of the most important causes of these small, silent strokes that create pronator drift is atrial fibrillation, an irregular heart rhythm. In atrial fibrillation, the upper chambers of the heart quiver instead of squeezing properly. Blood can stagnate, form clots, and those clots can travel up to the brain. When they block small arteries in the brain, you may not notice a big dramatic stroke, but you can develop subtle weakness that this test can detect. This means that if your result is abnormal, you should not only check your brain with a scan, you should also have your heart checked. Ask your doctor for an electrocardiogram, and in some cases a 24-hour heart rhythm monitor, to look for atrial fibrillation or other irregular rhythms. Sometimes, protecting your brain starts with treating your heart. High blood pressure is another powerful enemy. Over many years, uncontrolled high blood pressure stiffens and narrows the small arteries in your brain. They become fragile and less able to carry blood. That can lead to small areas of damage and weakness. Keeping your blood pressure well controlled, usually below 130/80, is one of the best long-term gifts you can give your brain and your heart. Lifestyle matters too. A diet rich in vegetables, fruits, whole grains, and healthy fats, with limited salt and animal fat, keeps your arteries more flexible and open. Regular physical activity, even something as simple as a brisk walk for 30 minutes a day, improves blood flow to your brain and keeps your muscles and nerves working together smoothly. Good sleep, stress management, and not smoking are all part of the same protection plan. I know that hearing about brain damage and stroke risk can be frightening. No one wants to imagine losing their ability to move or speak. But fear alone does not protect you. Knowledge and action do. The fact that you are here, taking the time to do this test with me, tells me that you care about your health and you are willing to take responsibility. That is the most important step. Remember, the pronator drift test is a screening tool, not a final diagnosis. It helps you listen more carefully to your own body. If your result is normal, celebrate that and keep building healthy habits. If your result is unclear or slightly abnormal, do not panic. Treat it as a valuable early warning and talk to a medical professional. It is always better to check and be reassured than to ignore something important. If you found this test useful, please share this video with your friends and family. Many of them may be living with hidden risks and have no idea. A simple test like this, done at home, could be the nudge they need to get proper medical care. I would also like to hear from you. After doing the test, what did you see? Did both arms stay steady, or did one arm drift or rotate downward? Share your experience in the comments. I do my best to read them, and your stories help our whole community learn. In an upcoming video, I will talk about another surprising warning sign that appears on your earlobe. It is called Frank's sign, a small diagonal crease that may be linked to clogged coronary arteries. You will not want to miss that. Make sure you subscribe to Dr. Heartwise and turn on notifications so you know when that video is released. Thank you for spending this time caring for your health with me. Remember, a wise heart and a healthy brain are the foundation of a long and joyful life. This is Dr. Heartwise, and I will see you in the next video.